So, how do you know if you're in perimenopause? As we've mentioned, perimenopause is the transitional phase leading up to the menopause, and it typically starts in your 40s, although it can begin as early as your late 30s. Now, the perimenopause phase can last anything from a few years, but it tends to last 10 to 12 years for most women. And during this time, your ovaries begin to produce less estrogen and progesterone, the two key hormones that regulate your menstrual cycle and overall hormonal balance. And it's the fluctuation in these hormones that are the main cause of those pesky perimenopausal symptoms. We're going to cover the symptoms in more depth later, but some of the early common signs of perimenopause include irregular periods. Now, this is one of the symptoms that many doctors look at first. You may notice that your period cycle becomes shorter or longer. Maybe you'll have a couple of periods during the month, or they may become heavier or lighter, or you may indeed skip periods altogether. It's really important to start tracking your period cycles if you're not already doing so. Hot flushes and night sweats, these are a common symptom. Sudden feelings of heat, often followed by sweating, especially at night. And many women in early perimenopause experience the night sweats first. Mood swings, feeling more irritable, anxious, or even depressed. Now, the changes with the anxiety, quite often it's a symptom that arises out of nowhere, and that's quite common in the early stages of perimenopause, quite often one of the first symptoms that many experience, and it's usually due to the decline in progesterone. Progesterone tends to be the hormone that drops first for most women. Sleep disturbances, either trouble falling asleep or staying asleep due to night sweats or other symptoms such as anxiety, overthinking. Again, it tends to be linked with progesterone. Progesterone is a hormone that aids sleep. Vagina dryness can be a symptom for some. A decrease in estrogen levels can reduce the vagina lubrication, leading to discomfort or painful intercourse. Fatigue, feeling unusually tired even after resting is very common. Memory and concentration issues, such as brain fog, difficulty focusing on things or remembering things. Even the most common words can suddenly just disappear from your vocabulary. But don't panic, these symptoms are only temporary. So doctors in both the UK and the USA tend to diagnose perimenopause based on symptoms, especially if you're over 40 and experiencing irregular periods or other telltale signs. There is further information on visiting your doctor or healthcare provider in this course. Some may recommend hormone testing through blood tests to check your levels of hormones such as estrogen and FSH, that's your follicular stimulating hormone. But it is quite uncommon in the UK for doctors to use blood tests now. They tend to go more on symptoms, as blood tests do not always show enough information until you get to the late stages of perimenopause or once you enter the menopause phase. It's these fluctuations during the perimenopause that do not always provide the clearest picture on the blood results. For a more detailed assessment, you may consider a private hormone test, such as the Dutch test, the dried urine test for comprehensive hormones. It is something that we provide, so please ask for that. And it is more commonly used in the USA. Now, the Dutch test provides it's widely used to assess hormone levels in a more comprehensive way. The Dutch test measures not just your estrogen and follicular stimulating hormone, but also things like progesterone, cortisol, testosterone, and other key hormones, providing a fuller picture of your hormonal health during the perimenopause or the postmenopause stages. And it can be an excellent option if you want to personalize a personalized insight into your hormone levels. Now, it's also worth noting that other conditions such as PCOS, polycystic ovary syndrome, can cause symptoms that overlap with perimenopause. Now, women in their late 30s and early 40s with irregular periods, weight gain, or mood changes may have PCOS instead. Now, a doctor may perform blood tests or an ultrasound to help differentiate between perimenopause and polycystic ovary syndrome. It's just something to be aware of. Additionally, lifestyle factors like stress and diet can hugely influence your hormone balance and make symptoms worse. High stress can increase your cortisol and disrupt your estrogen and your progesterone levels, leading to irregular periods, sleep issues, and mood changes. Some of the symptoms linked with the perimenopause. A poor diet, particularly one high in processed foods or low in essential nutrients, can also contribute to hormonal imbalance. So, if you suspect that you're in perimenopause, don't hesitate to speak to your healthcare provider. A combination of tracking your symptoms, maybe hormone testing and lifestyle adjustments can help you to manage these changes effectively. We are going to go into more depth of ways that you can manage or alleviate your symptoms, either with medication or naturally. Understanding how your hormones like estrogen and progesterone are affecting your body will empower you to make some informed decisions and to find relief from your symptoms. And just a few quick tips. It's really important to start tracking your period cycles. You can do this in an app or a diary, and we do mention a few apps later on in the course. And also keep a note of your symptoms. This can be extremely helpful when you go to your healthcare provider to be able to provide a list of your symptoms and a list of your period cycle dates. And knowing your period cycle dates can also be really important when you are considering hormone testing.